Now, as we mentioned, you are a breast cancer survivor. What were the first symptoms that you experienced? Tell us about that.
In my case, I really didn't experience any symptoms, but my mother is a breast cancer lady. And so what happened, I made it a point of duty to always have my yearly mammogram. So it was at the breast cancer screening with a 3D machine that they discovered I have stage 0 breast cancer.
Now, what kind of treatment did you receive and for how long?
Luckily for me, with my consultation with my physicians, I did not need chemo, neither did I need radiation. However, I opted to have a double mastectomy because of the medical history that my mother already had it.
And we know that breast cancer affects both genders, women and men. What are the first signs that people should watch out for?
The basic signs that I always advocate that people watch out for is to know the most basic, the color, the size, and the shape of your breast. And also there are other things that go within these three things. Sometimes you have a dimpling in your breast, which is the nipple going in. Sometimes it's a puckering, meaning the breast is dry and you see you're able to like peel it like an orange. Sometimes it's an engorgement and you're not pregnant and you're not breastfeeding. So if there's a swollen there, you need to see that something needs to be done. I encourage early screening. It's very, very necessary. Through the screening, hopefully when there are any changes, they would let you know.
And is this for everybody? Like, you don't have to have any symptoms for you to go to the doctor and say, I need some breast check. Do you have to have any symptoms? Or you can just walk into the doctor's office and say, I would like to know my status?
Yeah, definitely. Sometimes people do have symptoms when there are changes. So it's very important to know your body, know your breast, and know when there are changes. If it's swollen, if it's bleeding, you should be the first one to know, then you talk with your physician. But the important thing is once you notice any changes, go and investigate why and what that is.
As we mentioned, you raise awareness about black cancer, especially among black women here in the United States. What's the most critical piece of advice there to women out there and those are, our viewers who are listening to this conversation?
Again, early screening saves more lives and you have better chances of surviving. So for those women or us women who live within the United States, there are a lot of areas, there are places where you can go for screening. But if you fall within the group that you don't have those facilities available, once again, you need to know your body, know when there are different things happening, something outside the normal, then you need to go investigate that. So my thing to everybody is just know your body. Be the first one to notice when something is going wrong.
And what's the good age for somebody to go check for breast cancer?
Good age in the United States, depending from 40 and above, they ask that you go for your screening, sometimes 50. But again, black women get diagnosed at a much earlier age, especially people of African descent. We get diagnosed, twice the rate of our Caucasian counterparts. So it's good to know when to do what.